Hello, I'm Dr. Amy Schreiben. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about exactly what is systemic lupus erythematosus, also known as lupus or SLE. Lupus is an autoimmune disease, which means the immune system attacks the body because it confuses it for something foreign. The term lupus has been used to identify a number of immune diseases that have similar clinical presentations and laboratory features, but SLE is the most common type of lupus. People often refer to SLE when they say the term lupus. SLE is considered a chronic disease, and most people can live normal lives with treatment. Symptoms of SLE can vary and change over time, and common symptoms include severe fatigue, joint pain, joint swelling, headaches, a rash on the cheeks and nose, which is called a butterfly rash that is not itchy or painful, hair loss, anemia, blood clotting problems, fingers turning white or blue and tingling when cold, which is known as Raynaud's phenomenon. Other symptoms depend on the part of the body the disease is attacking, such as the digestive tract, the heart, or the skin. Diagnosing SLE can be a little tricky because the symptoms mimic other diseases. The cause of SLE is unknown. However, there are some concepts that have been thought to cause SLE. The disease isn't linked to a certain gene at this time, but people with lupus often have family members with other autoimmune conditions. It is also thought that environmental triggers can be a causative factor, and these include ultraviolet rays, certain medications, viruses, physical or emotional stress, trauma. Overall, gender plays a role as SLE affects women more than men. Women also may experience more severe symptoms during pregnancy and with their menstrual periods. Both of these observations have led some medical professionals to believe that the hormone estrogen may play a role in causing SLE. However, research is ongoing regarding the estrogen connection. Seeing your healthcare provider is very important in getting the correct diagnosis. Your healthcare provider will perform a physical exam to check for typical signs and symptoms of lupus, including sun sensitivity, rashes, as we discussed, the butterfly rash, ulcerations or sores which occur in the mouth or nose, arthritis, which is swelling or tenderness of the small joints of the hands, feet, knees, and wrists, hair loss, signs of cardiac involvement such as murmurs, rubs, or irregular heartbeat. There is no one single diagnostic test for SLE, but screenings that can help your healthcare provider provide you to come to an informed diagnosis. These include blood tests, such as an antibody test and a complete blood count, a urine analysis, a chest x-ray. Your healthcare provider will likely refer you to a rheumatologist, which is a doctor who specializes in treating joint and soft tissue disorders and autoimmune diseases. As SLE is a chronic disease, there is no cure. The goal of treatment is to ease symptoms, and treatment can vary depending on how severe your symptoms are and which parts of the body SLE affects. The treatments may include anti-inflammatory medications for joint pain and stiffness, steroid creams for rashes, oral steroids to minimize the immune response, and for more severe cases, disease-modifying drugs or target immune system agents can be used. It is important to speak with your healthcare provider about your diet and lifestyle habits. Your doctor might recommend eating or avoiding certain foods and minimizing stress to reduce the likelihood of triggering symptoms. Decreasing red meats and switching to fatty fish like salmon, tuna, mackerel, and sardines are recommended to reduce inflammation. You might need to have screenings for osteoporosis, since the use of steroids can thin your bones. Therefore, it is recommended for you to eat foods that are high in calcium and vitamin D. These nutrients strengthen your bones. Lastly, alfalfa and garlic are two foods that you probably shouldn't have on your dinner plate. The alfalfa sprouts contain an amino acid called L-cannavanine, and garlic contains allicin, ajohine, and thiosulfates, which can send your immune system into overdrive and flare up your lupus symptoms. Your healthcare provider may also recommend preventative care, such as immunizations that are safe for people with autoimmune disease and cardiac screenings. Over time, SLE can be harmful or cause complications in systems throughout your body. Possible complications may include blood clots and inflammation of the blood vessels, known as vasculitis, inflammation of the heart, known as pericarditis, a heart attack, a stroke, memory changes, behavioral changes, seizures, inflammation of lung tissue and the lining of the lung or pleuritis, kidney inflammation, decreased kidney function, or kidney failure. SLE can have serious effects on your body during pregnancy and can lead to pregnancy complications and sometimes miscarriage. Talk with your healthcare provider about ways to reduce the risk of complications. It's crucial to remember that SLE affects people differently, and treatments are most effective when you start them as soon as your symptoms develop. If you have any questions or comments on what we discussed today, please leave them in the comments section below, and we will get back to you. Remember, follow us on Facebook or on our website, The Boca Voice. I'm Dr. Amy Schreibman. See you next time on Medical Minutes.